What does the transplant process look like for a patient?
So when patients are getting admitted to hospital, they should expect that they will stay in a hospital for about 4 weeks. Might be a little longer, it might be a little shorter in some cases, but in average, that's how much it takes for hospitalization for allogeneic BMT. The first week or couple of days, they are receiving chemotherapy, in some cases also radiation, total body radiation. And 1 or 2 days after that, they are ready to receive the stem cells of the donor. So after the transplant procedure, from chemotherapy or radiation, patients can experience some complications. These general complications early on include nausea, vomiting, diarrhea, mouth sores. Some cases, they can be severe enough that patients will need IV nutrition or IV pain control related to these mouth sores. They have low blood counts and they will need transfusions, both red blood cell transfusion and platelet transfusions. And their neutrophils, which are the infectious fighting cells, can be very low and they are at risk of infectious complications, will receive antibiotics to prevent infections while they are in a hospital. And to prevent graft versus host disease, they receive immunosuppressive therapy early on after the transplant. And this is, we continue it up to 6 months in some patients and maybe longer if they have chronic graft versus host disease. But first 2 weeks to 3 weeks is the most vulnerable time period from complication risk standpoint due to chemotherapy and radiation. And after that, when neutrophils recover to a safer range and they don't have any active medical problems, we discharge patients from hospital. We continue to follow them very closely in outpatient BMT clinic, so they should be under care of a BMT provider up to 100 days from the transplant, since they still will be at risk of developing graft versus host disease or infectious complications or even organ toxicities. This is how I can best summarize the initial course of the transplant. And then after 100 days, so they no longer require caregiver support in most of the cases, and they can go back home if they came from far, and we see them infrequently while still assessing for chronic graft versus host disease or tapering immunosuppression to get them off immunosuppression by 6 months if they don't have any active chronic graft versus host disease for us to treat. I also want to mention that close to 15 to 20% of the patients will have ongoing chronic graft versus host disease that will not be able to take them off immunosuppression. So, and they require definitely ongoing care with blood and marrow transplant providers. But that's still okay as far as they don't have recurrence of their disease. And instead of dealing with malignancy, we end up dealing with condition, which is chronic graft versus host disease, and it's definitely more benign condition, and people can live with that. I mean, if patients are early after transplant and they are in a hospital, that first couple of weeks, they will have complications related to transplant procedure, such as I mentioned, they having nausea, vomiting, diarrhea, potential infectious complications. And this is the timeline that they are most vulnerable. That's why we keep patients in a hospital for close observation and treatment of all of these complications. However, their quality of life gradually improves, particularly when their neutrophil recovers and we discharge them from hospital. Most of the patients still will have fatigue for several weeks, in some cases even longer after transplantation, but they gradually recover, particularly if they don't have any active infection or graft versus host disease, then they eventually get back to their normal state and being able of doing their daily activities. We, however, require social isolation early on after transplant, in some cases up to 6 months when they are still on immunosuppression, to kind of protect them getting infectious complications. But then patients can start going back to work, and depending what type of job they do, Most of the patients will go back to work close to 6 months after their allogeneic transplant.